right here in this cancer center, community cancer center, what could we do that might improve outcomes for patients? We knew we had hundreds of patients that were on aromatase inhibitors, and we wrote out our own little plan. What could we afford to do? We could afford to do 8 weeks of randomly assigning the patients, some of them to very specified or directed exercise, versus the other group just being asked to do what they ordinarily would do.
This is a pilot study where pilot is a very small study where you're looking at a small group of patients, and if you see a positive results, then you expand it into a phase 2 or a bigger study, and then phase 3 is thousands of patients. There were 30 patients in the study. 15 were on getting the specific exercises. The other 15 was we just asked them to do regular exercise, and they found that when people exercise, the joint symptoms improves. So if you have better joint symptoms, then you're able to take the medication every day, and therefore you keep them without breast cancer recurrence for a longer period of time.
I strongly believe there's a value in a clinical study, yes. Well, because I think if you don't have studies like these, then no one's looking at the things that can help to improve medicine or pills or things that you're required to take. So it's good to know that that's being looked at, and again, to help people going forward.
Why was it important to participate in a research study? It's important to take steps to help yourself. It was a win-win for me. Plus, being involved with something that could impact the lives of so many other people, it was empowering. For anyone that's thinking of joining a clinical trial, I would say go for it. It's definitely worth it. You're helping yourself, you're helping the community, you're helping the doctors. You come out on top.
We were just blown away that there was a statistically significant difference in what they could do physically between the group that had a very specified program, even 15 minutes only, but a very specified program of what they needed to do, versus people doing their ordinary exercise routines. And we also had a not statistically significant, but a definite trend in reduction of the indicators of inflammation in the blood of the people that were doing 15 minutes a day of specified directed exercise.